Our staff were so excited to receive the Lantern Award. I think especially because it wasn't just leadership that was applying. Our staff really played a great part in writing it. We had staff editors and staff contributing writers. And I think over 25 people total contributed to the application. So then when we heard that we received the Lantern recognition and award, it was something that was shared by all our staff, so we're all so excited. We've already had a party celebrating it for ER Nurses Day this week, and there's a lot of excitement in the department right now.
I think that to be recognized by, ER nurses, as ER nurses, it just amplifies the compliment of the Lantern Award. And for our staff to know that they've made a difference and they've been acknowledged for being innovative and they've been acknowledged for the stuff that we do every day, that we do so naturally, or we try to, I think it's just especially heartfelt for us.
I think our facility is really proud, from the C-suite within our entity and across the organization. We're the first department to actually get this honor in San Diego. So not only were we excited within our organization, other organizations in town were actually pretty excited for us and already asking us questions about how to get Lantern. We're already starting to plan the big banners to go up on the side of the building, and we've been trying to hold back our excitement until we actually came and got the award. But we've been really starting to ramp it up this week for our ER Nurses Week.
I think like at a hospital level, the word that would describe it is everybody's excited. Like everybody, like we've spoken to several administrators and discussed the Lantern Award, and they've been genuinely excited for us. So we're very proud.
We are really all about innovation, and really I think it's about trying to make our emergency department the best place to work for our employees, the best place to practice medicine for our physicians, and the best place to receive care for our patients. And we've achieved that in really the trifecta, the top decile for all three. And that's really what our nurses want too, is to be able to see patients, work with excellent doctors, and make a decision to get them out safely and comfortably or admitted. And so our work has been applying lean processes to really improve throughput. Our times are extraordinary. We have less than 60 minutes from the decision to admit to go upstairs to a bed. We accomplish that with hourly huddles where the care team gets together every hour and reviews the patients and the goals and makes sure that we're all on the same plan using excellent communication. And then the nurse takes the patient upstairs within 60 minutes once they have a decision to admit with an RN to RN bedside report at the floor, which is, I think, innovative and really helps improve communication and throughput.
I think one thing I would add is, we took, over the last 2 years, we took our certification rates from 4 nurses in a large department to almost 50 nurses in 2 years by a lot of people coming together, both frontline staff, clinical nurse specialists, our leadership team, and setting that as not only an expectation for all nurses, but really almost mandatory in a sense, from really trying to encourage them to want to seek that professional recognition, and we've seen a lot of pride come with that.
I think we're pretty creative as far as sharing ideas, and I think that we also support our frontline staff to share their ideas. So we're always encouraged by leadership to think outside the box and to really just throw anything crazy onto the table, and then let's not throw anything off the table. Let's really try to exercise it. Let's listen to what the frontline needs and what they need to manage their patients as best they can. So I really think that innovation is founded in creativity and supporting the creativity, and we've created a culture that really does it well.